Hello everyone, and thank you for your interest in this IASP webinar. My name is Andrew Briggs. I'm a professor at Curtin University in Western Australia and a physiotherapist. I live and work on Wurundjeri land, and I pay my respects to the traditional owners of the Wurundjeri country. I'm privileged to work with a multidisciplinary team of professionals both within Curtin and internationally. Our work has focused on building capacity within health systems to respond to the burden of chronic musculoskeletal pain. We call this strengthening health systems. We see this work as critically important for ensuring that health and social care systems can respond now and into the future to address the needs of people living with chronic musculoskeletal pain conditions, and importantly, to ensure equity in access to healthcare. Many of you would be well aware and perhaps have first-hand experience that health systems internationally are under unprecedented pressure. This context has arisen not only from the experience of the COVID-19 pandemic, but also from war, climate change, and changing health and demographic profiles. Non-communicable diseases are now identified as the most significant contributor to the global burden of disease, accounting for more than 2/3 of the total disease burden. Many people die prematurely from non-communicable diseases like cancer, cardiovascular disease, diabetes, and chronic lung conditions, while for others, living with a non-communicable disease often means living with substantial disability, particularly for people who experience musculoskeletal conditions. While people might be living longer, they're not necessarily enjoying a healthy aging experience. Many are faced with disabling conditions that reduce their quality of life, and these are typically the musculoskeletal conditions. We know that musculoskeletal conditions affect people across the life course, from childhood through to older age. Musculoskeletal conditions are the leading cause of disability globally, and it's estimated that more than 1.7 billion people living with a musculoskeletal condition could benefit from some sort of rehabilitation intervention. Yet, despite the burden, many countries do not prioritise musculoskeletal health as a national health priority area, and this often results in underfunding of public health services, other service delivery for health, workforce capacity building, and research. Our team's work, in partnership with the Global Alliance for Musculoskeletal Health, aims to close this gap between the enormous burden of disease and responses by health systems. Our vision is to elevate the priority status of musculoskeletal health to ensure equity in access to prevention and management. To date, we've approached this by co-creating solutions for health systems, outlining what actions need to be undertaken and how. We've designed a systems strengthening roadmap with individuals and organisations from across the sector, including people with lived experience, health workers, researchers, policymakers, and civil society organisations, including the IASP. Our aim is to use this roadmap to support countries to build capacity, to support global health organisations like the WHO, and to support implementation of efforts to improve access to musculoskeletal healthcare, particularly for low and middle income countries. No one person, institution, organisation, or clinical discipline can tackle this problem alone. It needs a collective effort, now more than ever. Thank you.